Good morning, everyone. How are you doing? My name is David Rush. Welcome back. We are ready to get into our first patient panel. Patient panel on thriving on your own terms. So I just want to jump right into the bios here. Joining us today, we're going to have Melcha Journey. She spent 20 years avoiding dialysis and then found herself crashing into the ER and placed on emergency hemodialysis, home hemodialysis. After starting home hemodialysis in 2014, she left feeling great. Melcha is a passionate advocate. She now enjoys her role as executive director of Home Dialysis United with a long-standing focus on policy advocacy. Welcome, Melcha. How are you today?
I am great. I'm really excited. We're here again this year.
Good. And you're looking great too. All right. So next we have Dawn Lawler. Dawn Lawler is a kidney care options educator at US Renal Care and an ESRD patient with the transplant. Dawn dialyzed in center in the early 2000s. Prior to receiving her transplant, she has polycystic kidney disease and has been transplanted twice. She's also a nephrology nurse who works to educate patients about their home options. Welcome, Dawn. How are you?
Hi, I'm great, David. How are you?
I'm good. Good to see you today.
Thanks.
Next we have Rapa Rasha. I always mess this up. Yasharala. There it is. Rapa Rasha. I'm going to mess that up all day. We talked about this earlier too, Rapa, so forgive me. He's been dialyzing for 22 years now, and he has Alport syndrome, which he inherited from his mother, starting when he was a child. Rapa has done every dialysis modality and now does home hemodialysis with the Tableau dialysis machine. Rapa has been transplanted 3 times and rejected every transplant due to his underlying conditions. He is also a certified dialysis technician who loves caring for his fellow patients and advocating for them. Rapa, forgive me, but I'm happy to have you here, my brother. You're on mute, Rapa. Take yourself off mute so we can hear you.
There we go.
There you go.
You, I greatly appreciate you. I'm very excited to be here today.
Yes, sir.
Very good to
Thanks
see
for
y'all.
being here.
Thank you.
So, guys, so happy to have you all here. This is our first patient panel, Thriving on Your Own Terms. So happy for the second time doing this around. Let's get into some questions. I want to start this with Dawn. Let's start this with you. Tell us about your journey into dialysis and what you think others can learn from it. What can others take away? Everybody's journey is unique to themselves. Tell us about yours specifically and what you think people can learn from it.
Well, thanks, David. My journey started when I was 14, when I found out I had polycystic disease inherited from my dad. I didn't know when I was going to get sick, but my nephrologist told me it would be around the same time as my dad did. So that is exactly what happened. In my early 30s, I went into renal failure. Luckily, at the time, I had a friend who donated her kidney to me so I could preemptively be transplanted, which kept me off dialysis, which was wonderful. 6 years later, the kidney failed from a chronic rejection due to my kidneys, my polycystic kidneys, the cysts popping and my immune system continually booting up. So that is at the point that I went on in-center. The biggest takeaway from my whole journey is that at that time that I had to start dialysis, I was just put on in-center. I wasn't given the option to go home. And to be quite frank, number one, I was young. I was working as a nurse. I had a young son at home and obviously a husband. So my life was full at the time. And it pretty much, when the transplant failed, it just came crashing down on me. I did not feel well on in-center, which I realized could be individual to me. But even though I was young and in good shape otherwise, it just killed me. I mean, I was tired every day. I couldn't complete any of my tasks, my chores. Frankly, it was very depressing for me. I felt like people were pitying me, and it was just very difficult. So then, luckily in 2007, my sister donated her kidney to me, which fortunately was a perfect match. She just didn't inherit the kidney disease, the polycystic. So I still have that transplant. Luckily, 16 years later, I'm still doing well. And now pretty much my takeaway is now I have the power and the means to make sure that as many people, CKD people, can get to education as possible and to educate them on their options so that they do have the choice. So for me, that was my biggest takeaway, giving people the power.
Thank you so much for that. I appreciate that. You know, everybody's journey being different, the way we, you know, you hear a lot of stories of how we end up on dialysis, and then kind of that being the similar thing between patients, but the journey is always different, right? I'm interested to hear from Melcha about your story real quick, and give me some stuff that you wish people could, you know, can learn from your individual story and how it happened and affected you.
So I had CKD. I was diagnosed in 97. It was an unknown cause. And with my GP, physician doctor, we worked to control the symptoms as long as we possibly could, almost 20 full years. And that's a good record. But I when I'm talking with groups, I often say, I wouldn't be here today, but it wasn't convenient for me to die. During those early years, the clinics or the doctors always sent you to the dialysis clinic and get you familiar. And I will tell you that walking into my first dialysis clinic still remains with me as in a form of PTSD. I was totally overwhelmed with the alarms and the people and the moaning and the groaning. And I mean, I looked at it. My daughter was with me, grown daughter, about grandkids. And we looked at each other and said, I'm not doing that. And I would never have been, I wouldn't be here today. But as luck would have it, I started taking care of my mom who had dementia. And when I crashed, I didn't have the luxury of dying. I was all set to call hospice. My family, we all agreed, but it just didn't work out that way. And, you know, as they say, God proposes, man disposes. Here I am, you know, making use of that time, doing one of the things I love best, which is advocacy. So things work out the way they're supposed to. It's a journey. It changes. I can't even begin to think how many times my treatment has changed, my schedule, days of the week. I just live. And most of the time, don't even think about dialysis.
So the important part there is that you live, and that's what we're trying to encourage people today to do on dialysis, whether they're just starting, whether they've been on it for a while. It's the living aspect part of it, right? So Rapa, I know we talked earlier, man. We got to catch up a little bit. I would love to hear from you on, you know, a little bit of your journey, and what the biggest thing I want to hear from is how can you encourage people with what you've learned from it, on how to face it, whether they're going through it or potentially going through it in the future or going through it now.
Yeah. So, encouragement wise, if somebody's just starting dialysis, I would encourage them to get a strong foundation, because that's one thing that I take away from my mother. She gave me a basic foundation. She set me up in order to where I can be where I'm at now. She got me involved with peritoneal dialysis. And from that point, it wasn't too short after I got transplanted. So she had me set up very, very well. My encouragement is to find a solid team. If you're not with the team that you would like, try to do your groundwork to get a solid team. Basically, you're here now, so that's doing great, great for your foundational work. But really try and get that knowledge, like we talked about earlier. That knowledge, that education, reinforce that. Make yourself very familiar with the roles that certain people are supposed to do, such as your nephrologist, your dietitian, your social worker, what all these people are there for. Because it is overwhelming. It's going to be overwhelming. Take it in stride. That's all that you can do, is take it in stride. And I do take away with what she just mentioned, is that everything works out the way that it's supposed to. You know, I've spoken to you, David. I've spoken to all of you, and that's the key thing that I keep hearing. You know what I mean? Like, this worked out this way. I wasn't going to do this, but this just ended up happening this way, and life was like this, and it just happened. So, you know, it's going to work out. It will. You know, life is going to jar you. It's going to throw you that punch. But when you're down on the ground, and I was thinking about this when I was walking to go get my coffee this morning, you know, life is going to, it's like a boxing match. Life is going to throw you that hit, and you're going to get rocked, and you're going to hit the floor. But the real fights starts is when you're down there on the ground, when you have to get back up. And we're all a testament to that. We have to get back up. That's when the fight starts. That's when you got to start digging into that inner strength. whatever religious preferences you have, you dig into that, you find that, and you use that to persevere and to get back up. That would be my encouragement.
Very true.
As
Beautiful.
Dory said, I'm sorry, but
No, go ahead.
Said about you have to find what makes you want to get out of bed in the morning. That is the key element. When yes, you're right, Rapa. Life, it just keeps throwing things and hits at us. But as long as you have a reason to get out of bed in the morning, then we will keep carrying on.
So I got a question from the chat here. We're going to throw this in. So as you guys know, we're getting questions thrown in. People are viewing this real time and they're going to send in questions for us, right? So I got a question from Maurice in the chat. He wants to know any tips on how to connect with a good renal dietitian or helpful resources for figuring out your nutritional needs. I'll kind of jump in on this. So dietitians have it probably the hardest when it comes to us, patients, because we don't want nobody telling us what to eat. We don't want nobody telling us what to do. We fake sleep in center when they come by. We don't want to talk to them. So the dietitian is very important. If you talk to any dialysis patients, they'll be upset if you ask them what they're allowed to eat, what they're not allowed to eat. You got potassium issues, you got phosphorus issues. You can't eat nothing but air, really. And even the air might have a little phosphorus in it, right? So my suggestion for that is find a dietitian that's going to be honest with you, that's going to be real with you. Be honest with yourself. I know it's hard to make logs on what you eat every day and all that, but be honest. If you eat a lot of beans, if you love ice cream, you have to say those things. You have to be honest for that dietitian to really give you the proper assessment of what you should eat. You're going to hear a lot of things you don't want to hear, and you're going to hear a lot of things that necessarily may be your whole diet. But just make sure to listen to them and do those things in stride. You can have them in moderation and stuff like that. But I know I struggle with the diet portion of it, guys. I'm working hard. I'm working out every day trying to drop weight to get ready for my transplant evaluation. What are some of your suggestions out there for you guys? So, anybody jump in.
One of the things, we have a Facebook group where people, it's closed, so it's private. And one morning I remember looking and someone had posted they were in rehab for recovery from some procedure. And she took the lid off of her meal it was a single piece of white bread, not even toast. That was the renal diet that they had prescribed when she was in rehab. And I will never get over laughing about that. I mean, because that was the most inappropriate food you could possibly.
Yeah, that has phosphorus.
That's phosphorus and sugar and everything in it.
Phosphates, everything.
No bread.
Yeah. So when I go in the hospital, the first thing I do before anything else is to tell them, do not put me on a renal diet. And, I will go ballistic, because that is the exact opposite of what you need when you're trying to recover, from a procedure or anything. You need that strength. Right. So get a good dietitian. Your clinic should have one. If they don't, you might have an endocrinologist who has one. Your nephrologist should at least have someone. And then there's all these groups that have fantastic resources. Cooking Doc at AKF. We have Jennifer here today who works with a company that has some great products. So there'll be a lot of good information out there. And do not think that you have to just limit yourself to I always say it's not what you can't eat, it's what you can. Right. And even in moderation,
and as we always push back to research, right? Research, knowledge, do your homework, talk to people, ask questions. Rapa, I see you got something to add there. Go ahead, brother.
This is from my personal experience because my mother was actually a dietitian's assistant. So she would work with me and I would do well, and she would give me like little snacks here and there, like Cheetos or whatever. But as I got older, I took that into my own hands because I fairly didn't like dietitians because they would gawk at me a lot. So I would always like tell them to leave me alone because I would count my own stuff, and I still do it now. Like this here is watermelon juice. This is 32 ounces of watermelon juice. This is what I'll be taking in for the day. And this amounts to like 1,000 milligrams, 1,000 and some change of potassium. So I count my potassium. I look stuff up. I count my phosphorus to match my fluid, to match my eating goals. So that way I can stay within my ranges as far as that goes. So if you want to try and be able to get into that, you can basically eat whatever it is that you want. just as long as you stay within those parameters. Now, it doesn't
Moderation.
mean you need to go crazy or whatever, but like he said, within moderation. If you can do the counting of the milligrams for your potassium and your phosphorus and start adding stuff in there, then by all means do that, because that will definitely work out for you.
Patients, don't starve yourself. Don't go crazy over the food. Don't, be cautious of what you're doing. You know what I mean? But let's move on here. We got another patient chat with a question, which I think is cool. Dawn, I want to kind of direct this one to you. This is from Kimberly in the chat. She says, I have CKD and lupus nephritis. Are home dialysis treatments different for lupus patients?
No, I don't believe that they are. I know that you're going to have exacerbations at times, most likely. Kimberly, you probably know that. But working with your nephrologist, you're going to just speak with him about that. And you're going to, normally you kind of know when those are going to be, but they shouldn't affect you as far as a home modality. If anything, a home modality is probably much more proactive for you, because this is going to give you the education. It's going to let you have control over your treatments. Only you know how you feel. Do I feel good today? Do I not feel so good today? And then you can communicate with your healthcare team. And that's the other important thing, is that team is there for you. For everything that you need. So communication really is key. Like Rapa, you were saying, yes, I know how much potassium, I know how much I have to drink. A lot of the nurses, we talk all the time about how we see a patient come on a home modality virtually knowing nothing. And then we train them and they go home, and over time, they become the experts on themselves, right? You know what you can eat, you know what you can drink, and you know when you don't feel right. So communication with your healthcare team is key, because every patient and the care is customized, okay, especially at home.
Very true.
So
one thing I want to add that's often overlooked, and that is the fact that the medications we take, a lot of dialysis patients can easily take up to 20 medications a day, and these can severely impact your phosphorus, your potassium. I remember when I was having trouble with phosphorus, and the dietitian was getting frustrated because she kept saying I wasn't eating right. And I did a food diary and I handed it to her, and I didn't even make 400 micrograms of the daily allowance of 800 micrograms of phosphorus in a day. So I knew it wasn't what I ate. I ate a very healthy diet, but I did know that the Benadryl that many of us take for during treatment for itching, things like that, one dose of Benadryl in a day will provide all of the phosphorus that you are allowed usually in a diet. Wow. And you then add all the other medications that have phosphorus and potassium in them, you can easily be over your daily limit and not even know it. So
yeah, that's what I mean. So you either can eat air or take air medication.
Yep. You have to take, be a detective and look. And I've actually looked up the content of drugs to see how much is phosphorus stays. So I could go back to my team and say, what do you want me to do? I can't change my diet any more than what I've done.
Right. So, and that's why it's so important too that you tell your healthcare people all the over-the-counter medications that you're taking. Because if that's not on your med list, they don't know you're taking it. And that could also contain potassium, phosphorus, sodium, calcium, all of those
things. So I want to jump into a question here that we have here. Being that we are talking about home dialysis, right? And we're talking about modalities. We're talking about, talking to your doctor, finding out information, getting knowledge for your specific care. How does home dialysis entail help you guys, or others that to thrive on their own terms? So we're talking about doing our own thing and making sure we're aware of what's best for us. Being home dialysis patient, for me personally, it just allows me that freedom, that independence, that schedule making, that moving around, doing what I need to do when I need to do it type deal. I'm interested to hear from you guys on what home dialysis has done for you and how is it helping you to thrive on your own terms. Anyone could jump in here.
So the one thing that I think has really made my quality of life superb for 10 years is that, and I was only able to do this through home dialysis, was keeping my residual function. Most patients who start on dialysis in center, they take the fluid hard and fast. I mean, your treatment is rough. And I was just reminded that recently. I hadn't had an in-center treatment in 10 years and had one in the hospital. And I was like
Brutal.
wasted. Brutal is the word I used.
Brutal.
I said, yes. So the whole point here is that you want to make sure that you are looking at your schedule and what you need. So I didn't do pain. And when I started to have pain in my first 3 hours of treatment, 3 hours went fine. And at the 4th hour, I was in such pain that I had to stop the treatment. So my doctor came back with the labs and he said, you're really good. You just need 2 hours and 45 minutes. It's very hard to find someone who has been on dialysis for 10 years and still has residual function. Yeah. And the only reason for that is because I took control in the center early and monitored it at home. And for me, that allows me to miss an airplane and not have to panic about where am I going to get a treatment, or go to the ER. It's not going to be as critical. So for people starting out, I am really, really encourage them to monitor their functions, how their body feels at different times, and know what works for you and what isn't working. Listen to that pain, because dialysis done right should not ever hurt.
Right, Rapa, I want to hear from you on this one.
Well, what it does for me, man, it's awesome because I've been in center, and we talked a lot about the things of in center. In center isn't necessarily to make people fearful of what's going on in center. Of course, this is meant to empower all of you and to help you out. But all in all, you can thrive in center. Don't get me wrong. If you just learn certain protocols for yourself and you're very, I like to say, accountable. So what this does for me, not only does it allow me the freedom, like you were saying, freedom of choice to do my dialysis whenever I want to, I can go and do what I please. It keeps me out of the unit. If this is for somebody who's just starting off, units will drain you of your fluid. She's able to keep some of her residual kidney function. You go in unit, they're just going to suck you dry. They're going to go based off of the one shoe fits all approach, and that's just going to be it. So you're able to monitor yourself. You're able to keep your kidney wet a little bit, give it that wet environment, so that way you can thrive. You can just be better. I wouldn't necessarily say that all units are bad and so on and so forth, but home dialysis for me personally, it has allowed me to really be accountable for myself. The PTSD thing that she mentioned, there was actually a study that was done because I looked it up. Dialysis patients actually have chronic PTSD. They end up developing chronic PTSD. And there are a lot of mental health issues within the dialysis community that aren't addressed. They're addressed very poorly because they only have the social worker. And once you're in there, you have this situation where it's like you want people to be able to do their jobs, but yet you can't really count on them to do their jobs. And not only can you not count on them to do their jobs, you have to be situationally aware at all times. You just can't kick back and go to sleep. You got to be monitoring who's coming through the door and all this other stuff. You can often get labeled, oh, well, it's my word against theirs. And then somebody can come in and say, well, this person has dialysis equilibrium syndrome, and now your opinion doesn't matter because, you're not right up here. I've heard situations like that before. So when you're in the comfort and the confines of your own home and you have people around you that care and they love you and so on and so forth, that adds to the general takeaway of stress. When I first started this and I felt the pain leave my heart because around here in my heart, after running that 400 blood flow rate for a while, for just years, that pain started settling in. And so when I first started home dialysis, first it was nocturnal. Nocturnal allowed me to get away from that. But when I started doing this, Lord, That pain left. I told my wife, I said, yo, I haven't felt this in years. It's not there. I mean, I would just sit there and just take it. Because dialysis is the equivalent of running several marathons at one time. That's what it tells me in my textbook. If you read the textbooks about dialysis, it lets you know. So this is cool. Stay out of the unit, try to get out, because those machines are extremely harsh on your body. It's harsh on your heart. It's harsh on your blood vessels. But if you have to be there, try to get nocturnal. Do anything it is that you can do to where your body is your top priority, and just don't let them stick you in the machine. You know what I mean? The overall rotational
Right.
at the
don't get caught in the loop. Don't get caught in the quantum realm. You know what I mean?
With like what you were saying, Rappa, when the minute the day comes and you're thinking about going, that anxiety, it grips you. And then you get there, it's almost like everything in your brain goes blank.
Yep.
And
your favorite technician isn't there.
Your favorite technician isn't there. Your favorite chair is not there. You forgot your pillow. You forgot your blanket. Now you're going to be freezing. All those things go to your brain.
And you're shaking, and you're just like you totally blank out, and it is where that PTSD comes in. You're in it. That's it. Yeah.
I always remember Dory saying early on, do you want to feel like you have drip irrigation or a fire hose? That's the difference between literally running in center at 450 to 500 or running nocturnal at home at 250. Low and slow beats the game every time.
That's it. And that's what your body wants too.
That's what your body needs and wants. So real quick, we have a few minutes left. I don't want to, miss out on anything for any information for people here. General question, one question, one word answer if possible. Rappa, what machine are you using at home?
Right now, I'm using Tableau from Outset.
Okay. Melcha, what are you using?
Page.
Using the next stage machine. And Don, you're transplanted, correct? Or are you?
Yes. And I haven't been on home hemo, but I am familiar with next stage. Have taught home hemo on next stage. Okay, perfect.
And me, myself, I'm using the Tableau machine at home. That's for some people in the chat who just wanted to know what we're using. So we have 2 minutes left. I want to get a quick answer from you guys just to wrap it up for today. What are you hoping to learn during today's events, and what are you most looking forward to? We can answer that within 15 seconds each, just so I don't want anybody to get cut off. Let me know what you think. Go ahead.
I am loving all of the comments in the chat. Keep them coming. We're going to learn from you as much as you're going to learn from us.
Right.
Yes.
Right. That's definitely. I'm looking. I want to see more on the professional segment. I want to definitely see what it is that they have to say, and caregivers, their approach, because my wife is here. She's my caregiver. So she's listening on the side. I definitely want to see what we can get out of that.
And Dawn?
I'm just happy to have the whole community here. We all know that transplant is not a cure. It's just another modality, another treatment. So for me, I know that if my transplant fails, I'm going to go to home hemo. So I have the perspective of a nurse, but I want to hear how people do on home hemo, and how they handle it and how they fit it around their life. So I'm looking for information from all the other patients to help me out.
All right. Sounds good. I want to thank you guys all for joining us in this panel. What a great discussion, to kick off this day. I'm very excited for what's it going to bring. I'm looking to see all the panels going on, the patient perspective, caregivers. My wife is also my caregiver. I'm excited she's going to be joining me later on today. So to everyone listening, we're about to enter our first breakout session where you can choose to attend either two of our simultaneous sessions or a breakout session. The first one is going to be tailored for people for pre-dialysis and want to get more overview on what to expect and how to think of what's coming next, tips and everything like that. The second one is for people who've been on dialysis and who want to understand more of their options and explore other modalities and machines. So those two are going on now. So also, if you're on social media watching this, you're going to have to register because the rest of the show will be set on there. So make sure you register so you can watch the rest of the show. For all of our people joining us on social media, thank you so much. And to choose a session, continue today's program, click on the session tab. And on the left-hand side of your screen, then make your selection. We'll meet you back here on the main stage afterwards at 1 o'clock for another great panel discussion. My name is David Rush, and I will see you soon. Enjoy yourself. Enjoy the rest of the day. Peace.